As any stroke survivor knows, surviving is just the beginning of the journey. The lasting physical and emotional effects can take a large toll on patients as well as family members. And many people don't anticipate that stroke survivors may need to learn how to walk, talk, and perform basic daily activities all over again. Spokesperson for the March of Dimes Stroke Recovery Canada program and World Wrestling Champion Bret the Hitman Hart experienced a stroke as a result of a bike accident in June 2002 and knows all too well the challenges of recovery.
I think the hardest part about recovering from my stroke was the very, very beginning, the very first sort of, when you first sort of start to understand what you're dealing with and knowing that you got a long recovery. If you ever get, and if you're lucky, you'll get some of it back. I know that I wouldn't have made it if it hadn't been for the people around me. And the message that was loud and clear from everybody that I spoke to was, don't give up.
Stroke survivors may experience memory or problem-solving challenges, difficulty in reading, speaking, or understanding language, and may experience personality changes. Physically, stroke may cause paralysis or weakness on one side of the body, vision problems, fatigue, and incontinence. Dr. Tom Miller, a physiatrist, a physician who specializes in rehabilitation medicine at St. Joseph's Healthcare, says that though daunting, the physical effects of stroke can be overcome.
Stroke affects a part of the brain, so there's been an injury to that part of the brain. One of the more challenging aspects and difficult from a functional perspective is what we call spasticity. Spasticity is a lack of control of movement, or more importantly, stiffness, or an increase in tone in the muscle. So therefore, people can't use that arm or leg functionally. Spasticity requires a comprehensive approach. Those include physical therapy. We can use medications orally in which to decrease tone. But lately, over the last 10 to 15 years, we've been injecting drugs directly into the muscle. Those drugs are referred to as botulinum toxin, and they decrease the muscle tone with the ultimate goal of improving function.
Comprehensive care from a cross-functional team of healthcare professionals, which may include a neurologist, physiatrist, physical therapist, and family physician, can help minimize the impact of stroke on patients and their families. Tony Nevis had a stroke 19 years ago and knows the full impact of spasticity.
I experienced a stroke in 1992. I was 32 years old at the time. I used to be a hockey player, played baseball, was a golfer, anything, skiing. I was very active, and today I'm a shut-in. What spasticity did to me was it affected my foot more than anything, my foot and my arm, obviously more than anything my hand, my shoulder, my leg, my knee. Botox has helped my hand. Like I say, it's been about 3.5 months since I've had it, but when I do have it, my hand gradually gets back to, not like this one, but a lot better than what it is now. The last time, like I said, was 3.5 months ago, so you can see that my hands are coming apart like this, and my fingers are all starting to twist upward, and that's showing me that it's about time that I go in for some more.
Stroke survivors and their families are not in it alone. March of Dimes, through its program Stroke Recovery Canada, helps Canadian stroke survivors reintegrate into their communities and thrive after a stroke. For more information about stroke recovery resources and support, visit marchofdimes.ca/src. Sherry Dematarco reporting.